innovation admits several definitions. All of them are in line with the goals and aims of La Caixa Foundation and with the leitmotif of the meeting we have today. So it's research for the future of health. But this journey from research to having an impact of the health of real people can be, citing Sir Paul McCartney, a long and winding road. So if innovation is difficult to define, it can be even more difficult to measure. So we have selected today just one indicator that I think that is useful, especially for early stage innovation, that is international patent applications. Really broadly speaking, we can say that for each PCT, international patent application, there's one invention in the world. So only 8% of these PCTs in the world are coming from universities, research institutes, and hospitals like yours. So talking in other words, it means that when you are patenting something, you are not only competing with all the researchers in the world, but also to 10 times more inventions coming from companies. If researchers are a small portion of the inventors, the situation with women inventors is also quite sad. Also, it's been increasing during time. Only the 18% of inventors were women last year. So if you are a researcher, an inventor, and women, well, you are not really mainstream here. Okay. Well, probably I have started quite negative for being this afternoon, and I would like to show some positive data on this regard, because Spain and Portugal are in the top 5 on this regard. So almost 27% of inventors in Spain last year were women. This is position 1. Oh, that now it's working. So it's position 1. There's a little problem on this report because Portugal were not listed. So I'm also including information about the European Patent Organization that in 2022 put also Portugal and Spain in the top 5 in women invention rate. So when we are looking these PCTs in the world by sector, and the biomedical sector is the one that is of our interest today, there's the 60% of PCTs in these biomedical fields. It stands more or less half for medtech and half for pharmaceutical and biotechnology fields, which stands for 40,000 patents per year. If we go a little bit further in the development of a potential therapy, the number of clinical trials that were started last year is 5,000. So we are going from 40,000 to 5,000. So it means that last year there was just one clinical trial per 8 patents that were filed. Okay. And if we just step a little bit more to the end of this road, only 69 products were approved in last year. So if you just divide it, there is something that cannot be done, because obviously a product that has been launched in 2023 has been developed during 10 or 15 years, but we can just have a general figures that per each product that were approved in 2023, there was 500 patents in the world. Okay, so adding to this situation, these figures normally goes with a suboptimal innovation system. This is like describing the water you are swimming, so I'm kind of uncomfortable with that. But we can see that at least in our countries, And it is something that we have been discussing with all of you, and it's been matter of discussion in previous editions of CapRoach here, and some of the ideas that are here listed are coming from the researchers invited. There's some cultural issues, so you can say that research is driven by curiosity and knowledge creation, and that innovation is market-driven and is often, in some places, viewed like less prestigious, and that research teams lack of knowledge in innovation or tech transfer. We can add that there's some barriers, institutional or governmental. Some of the more cited things is that the tech transfer offices of the institutions are under-resourced, and then there's a lot of bureaucratic hurdles for funding expenditure or justification, or for licensing or to creating a startup that sometimes can be not as fast as it would require. And last but not least, the lack of incentives. So you really know better than me that papers and grants are the main criteria for career promotion, that research grants do not normally support innovation activities, also is changing with time, and that there's a long and uncertain financial return for commercialization. So altogether is paving this road that I was mentioning at the beginning and put researchers in this situation. So when you have to decide where to put your efforts, time, and resources, you can choose your left road and apply for a health research call that is 6% in success rate, or to ERC consolidator that last year in life science was 14%. This is something that is normally necessary and is urgent for you. And you are normally top experts in this field. So you really don't need help on that. You know how to do it. In the other way, if you go to innovation, we have put together all this data at the beginning. Time for development of a solution can be from 10 to 15 years. The average cost is from $1 to $3 billion. The success rate is just for one invention you try, is this less than 1 in 500 patents. If you reach clinical trials, it will be the 5%. And indeed, this is optional for you. You normally are not experts on innovation, with some great exceptions that we have here, of course. And this is a really uncertain roadmap. So probably this is something that needs a further analysis and a deeper discussion. But this can help to understand the performance of Spain and Portugal in innovation. This is a piece of data that was prepared for an innovation meeting that we did in Lisbon on July. And there's just an overview of how is the publication state and the innovation state in our country. So if you go to publications, this is really like James Bond. If you go to publications in biomedical fields, you can see that Spain is in a great position compared to Netherlands and Belgium. Although Portugal is close to Belgium, it has the higher growth rate in publication in this field of all these countries and all Europe. So in the last 10 years, Portugal has been increasing the production of publications in this field enormously. But when we compare these results to patents that has been granted in the biomedical fields, Spain are performing not as good as Netherlands, for example, or if we go to co-publications by private companies, we see that Spain and Portugal are also below Netherlands and Belgium, for example, just to pick some of the countries that are closer in the economical situation and not putting US, for example, or China here. So we see this situation as an opportunity, not only for that, but especially because innovation is obviously addressing a real need, so it has to be market-driven, but it's not possible to be done without knowledge. So we really need supporting research to having good innovation. Indeed, there's a lot of famous examples on that, from penicillin to PCR to CRISPR-Cas9. There were innovations that came from research projects that were not focused on innovation itself. So there was no therapeutic view on the knowledge that was generated, but that was used for innovation with time and with the look of proper eyes. And on top of that, during this innovation process, knowledge is generated. A great example of that would be the production of vaccines based on RNA, for example. They were ready for COVID to come. And there's also impact on, for example, generating new jobs, like mine. So especially for this thing, no, especially for that, because this is an opportunity in Spain and Portugal, and is in line with the aims of La Caixa Foundation. 10 years ago, we created the Caixa Impulse program. This is a program that is supporting health innovation, surely, and that we reshaped with our team, Alex and Jorge, that they are there. We reshaped it 2 years ago to connect it directly with the research call. So if you see that here, okay, I can handle that. So here, from the health research to the commercialization of a product, there's what we normally call the death valley. That is another way to talk about this complicated road. And it's what happened with funding available for research and for innovation. So I see some heads that are shaking. And there's some money available for research, but when you are developing some solution, then the funding available is going down until a point when the risk is below enough to then having a lot of interest for funding. So what we're trying here to do is to build a bridge to cross this valley through a program that is designed like this. This is the fundamental structure of the program. For those of you that don't know, it will be opening again in December. So if you have interest, you can contact us. But there's a single entry. So any proposal for a project is pre-selected in the same time for a remote peer review evaluation. And projects can go to 3 different stages. We were thinking a lot about the naming, and we end up with the stage 1, 2, and 3. And stage 1 is just supporting these initial ideas that are coming from research with just 50K. Then there's the stage 2 that is not only focusing on the validation and development, but also provides a specific training that is mandatory for participants. And then stage 3, that is the last stage that is supposed to provide enough funding for the project to attract or private investment or license with private companies. There's a specific thing for this project that is a whole track, because you can get this maximum of 500,000 euros, and going from one stage to the next one with a fast track. So if you are selected in stage 1 and you finish all the milestones, you can ask to go to stage 2, and you have one chance to go directly to panel selection, not to pre-selection. Okay, so once you are in the program, you can reach all the stages easily than the others that are outside. But on top of the funding that we are providing, and I would say that probably even more important from certain projects, we are building the ecosystem that I tend to define as suboptimal. So providing this training is one of the things we do. So we have 4 weeks for our this with experts in the different parts of the development track. We have mentors. We have 20 mentors that are internationally recognized experts, that they are helping all the projects to define the next steps on the development and to identify the best value proposition to continue with the project. So they are paramount for our project, for our program. And then we have a bunch of experts, so more than 600 now and increasing, that has a specific expertise for the needs you can have when you are participating in the program. And obviously, we are organizing networking activities like today and others to build this ecosystem and to extrapolate what has been happening in one part of Spain and Portugal to the others. But on top of that, and this is a special slide for you today, we have a specific innovation services for CaixaResearch awardees. So all this knowledge we have, all the experts that are in our Caixa Impulse network that are providing support to the Caixa Impulse awardees are available for you. And what we are doing now is scouting what are you doing in your research projects. Some of you have been meeting indeed with me, and some of you have already participated in Caixa Impulse. When we identify some innovation that can come from your results, we analyze what you really have. Sometimes from this analysis, we end up with the conclusion that your project is good to go, or we end up with the conclusion that probably is not the time yet. But if it's the time and you need support, we can put all these experts with several different kinds of expertise. This is just a list, it can be random. So we just find any other expert, if it's not in our list, that can fit your need, to help you to write the proper value proposition coming from your results. This is why you can have this tailored guidance for preparing your innovation proposal. And what's been happening during this time, we have results for these 2 years. First thing I have to say is that there's a clear correlation between excellent science and innovation. I say that because the success rate in Caixa Impulse is 7%. But CaixaResearch Health awardees that has been participating or sending proposals to Caixa Impulse had a 17% of success rate. So it's twofold increase. And it has been quite activity in this because almost one quarter of the teams awarded in CaixaResearch Health during these 5 editions that are here participated in Caixa Impulse last edition. And what's the readout of the tailored innovation support? So for those that are awarded in CaixaResearch participating in Caixa Impulse, without our support, some of them here, the success rate is 10%. For those that receive our support is 38%. So it's a 3-fold increase, and it's even a 5-fold increase in success rate compared to the call. It doesn't mean that we are providing support to everyone, and as I was talking with somebody during the lunch, we tend to provide a really agile process. So we start with really informal meetings, and then we see if there's something that we can do together, because from the proposals that has been analyzed for us, only the 22% has received support, and from this 78% that have not received the support is because or they were ready or they were too early to go to Caixa Impulse, and we just provide some indications, and we will certainly meet in the future if there's something there. So because this is just 2 years results, and these statistics can be quite early too, and because we know from 10 years of doing Caixa Impulse that this support can be adapted to your needs that are really evolving with time, We will really be happy to receive suggestions to improve our support. And obviously, if you have any idea of innovation, we'll be here around, and I will be happy to talk with you. So thank you so much.
Thank you very much, Jordi. Since it's really your projects he's mostly talking about here, it should be your questions. But one thing I can't resist asking, given the video you started, is what's your short answer? What does innovation mean to you?
You should advise me about it. I don't know. No, I mean, I think
it would be less fun.
No, nice. No, certainly innovation is something that is new, but is useful. Sometimes we can have this definition from the market acceptance, so it's more linked to producing money with this invention. But what I really think is that this is one part, and it's important because project has to be sustainable, but somebody has to be interested in the result. So it's novel knowledge, but that is useful.
Because I wondered from the very first few slides of your presentation, you were presenting it as you might say a risky game, you might say a fool's game. There's a lot of people trying to innovate with very little success.
Yeah, no, that's true. But during the path, you are providing more knowledge, and we are progressing all together with that. So I think that the COVID vaccine is a great example of that. So we were ready to produce this amount of vaccines because there was a lot of technological innovation on this process, and this is just a simple example of that.
Yeah. Okay, as I said, mostly questions from out here, I hope. We're going to go there first, and then we're going to go there second.
Thank you. Thank you, Jordi, for the presentation. It is related to what we discussed this morning. Mm-hmm. So for you, useful means that is going to be buy it, that is somebody is going to buy it, is going to pay for it. Mm-hmm. Because, for example, rare diseases, mm-hmm. if there cannot be innovation with rare diseases?
Well, there's a bunch of innovations based on rare diseases. That's true that the idea of being bite can always let us think about pharmaceutical companies doing a lot of money. But what it's really true, like with bread or fruits or clothes, is that anything that is useful for life, at least it has some costs. I'm not saying that it has to be a great benefit of that, but if there's not somebody paying for the cost of things are not happening really. So they can be foundations like us, it can be governments, or it can be private companies paying for the development of something, but somebody has to do it. And then at the end, somebody has to pay the cost of making this solution to reach the patient. And if this is not happening, innovation is not happening. So this is my way to see it. So it has to be at least sustainable.
Okay, we had over here, I think.
Thanks, Jordi. Can I ask two quick questions?
Let's try.
Let's try for the first one. So one thing is not clear. So in the Caixa Impulse, how does it interact with all the funding schemes? So for example, the ERC proof of concept, is it like mutual exclusive?
No, there's no exclusion on that. No. Indeed, we try to make you apply for other grants if it's possible, just to increase the impact of our support. So it's perfectly happening. So there's a piece of data that is really interesting. So almost 1/3 of the projects that were awarded in IAC Accelerator grant were previously awarded by Caixa Impulse.
I see. Mm-hmm. Second question, can I?
Second question?
Quickly. Yeah, so also related to that, you didn't talk about private investments. Mm-hmm. I don't know, I mean, like Caixa has a branch on that side, but you haven't connected. Is there any, is that a bridge that actually happens, or you see what I mean, I guess?
Well, it's something that I forgot to mention, and you've seen the symbol here. So previous CaixaResearch, now Criteria Bioventures, are collaborators of this program, so they help us to define what is useful, and they are also obviously looking at the projects that we are supporting. But this is an independent road. So obviously they are interested in the projects that they are in Caixa Impulse. They are looking at the development of the projects that we have in pipeline, but they have their own criteria of investment, and they invest on the projects that they fit with their strategy.
Okay, I think next along.
Thank you. Since we are reflecting about innovation in health and about what do you think, what do you mean of innovation, my question goes on the other side, because we all have an intuition on what health means. But of course, a very proper or whatever exact definition, more than proper, of health can completely change the path of innovation. And to be more specific, typically health can be defined at the personal level or at the society level. And if we go on most of the time in our ecosystem, the need is of the patient. So we go on the personal level, and we tend to do a research that might not be sustainable at the end, because we tend to produce more expensive research, more expensive therapies that are more effective. But at the end, the sustainability is a more global and shared concept. So I want to know if, like the Caixa, what is the position, in a sense, in a more concept, almost philosophical sense, of what health means?
Thank you for the question. This is a really interesting thing. Probably we'll need a cup of wine afterwards. No, I have to say that I've been trying to avoid the word therapy during this presentation, just for that reason. So we are talking about health, and health is not always going to patients that need therapies. Even it can be avoiding these people to get sick. But if we are talking about global health, obviously this position, and this is something that is quite important in the sector, because as you said, the prices of therapies are increasing. And if you detect that there's a therapy that can be really useful, but just for a really minority of the population that can pay for it, probably is not the best solution. But you are in a balance of what are you developing? Great solutions that probably with time can decrease prices because you find a way to make it cheaper, or just avoiding developing these great solutions and go only for those that your health system can pay now. So this is a discussion that I cannot solve, and I think that not even all the sector can now solve, because it's a hot discussion.
And another factor of this is you'll get a lot of money coming in for longevity, which is maybe not a top priority, or increasing birth rates, which is maybe not a top priority, but for those people who are funding it, it is.
Sure. I mean, if you go.
Okay. Well, you should give the mic.
I was saying that I strongly disagree that longevity is not top priority, and this is indeed one of the discussion that whenever I am facing investor is the center of the focus for me, because I work on aging, and that's a point. And I see exactly what Jordi is saying. This is not an easy discussion, an easy solution, but still innovation per se needs to be sustained, and this cannot sometimes, in my opinion, be limited by what can be immediately available.
You may have to do the cup of wine thing about longevity.
No.
Okay, any more? I want to make sure I'm looking at the back as well. One there. Just because you're way at the back, you are still allowed to ask questions if you want.
I just wanted to make a comment I'm from the UK, and we've been through this, and your point about there not really being an impetus to go down that innovation route because of the lack of impact on promotions. This has changed markedly in the UK as a result of something called the Research Excellence Framework, which is something the UK government brought in. And one of the major criteria on which the academic institutions are judged is the impact of our research. Yep. And so, because that's now important, the universities are now including impact as a criteria for promotion. So although we sometimes don't like the interference of governments in our research, sometimes it can be helpful.
Although, can I add a caveat, as another person from the UK, we also know that sometimes universities find quite clever ways to fit those criteria without doing the stuff that actually makes all the impact.
Shh.
Okay. Sorry,
I don't know. I think I'm not one to intervene in a UK discussion. No, but I really think that is an important thing. I tend to write sometimes what NICE is saying about impact in health. We are trying to analyze also the impact of our initiative, and this is not easy to do. So there's a lot of discussion for that. So saying that impact is important, it's great, but how to measure this impact is not easy, and in innovation and research is not easy. So, I mean, the idea is great, but how to implement it is not something that I think it's solved yet.
Okay, we've got one there, and then one there.
Yeah, so here. So my question is about the finances. So how much does La Caixa spend in the innovation program versus the research calls? And is there a wish to change this? In which direction?
Sorry, but I can't.
Okay, so how much time, so how much money, so money. So how many million euros are spent in the innovation call versus the more fundamental research program? And is there a wish to change this, and in which direction?
Okay, no, I would say that probably the funding that we are investing in innovation is about the health we are investing in that. If you put all together, I mean, I have not exactly the data here, but what we are seeing now in the success rate, of the programs, is that we are not tending to increase the budget in innovation yet. So the success rate, I think it's okay, and it's just 2 years of the new structure. And I don't know if there's a way to increase funding in research, but probably is something that can happen more because the success rate is lower.
Okay, we're very, very out of time, but we've got a question here and then there. So, shortest answer you're comfortable with, Jordi, would be great.
I'll come back to the first part of your slide. We know the diagnosis that we do not innovate, but I don't know what is the disease. Why do not innovate? For example, if we compare the patents that we produce based on the money that we put in the R plus D plus I system in Spain, for example, if you normalize this ratio, how do we do compared to the States? Because maybe the disease is not that we do not innovate, is that we don't have enough blood to innovate. And if we do not identify well the disease, we cannot solve it well. I mean, your initiative is great, and I think it makes a great input in innovation in Spain. But maybe we are focusing the cause of the disease. You are trying to solve it based on a diagnosis, and you are being successful, and we are grateful for that as well because it helps us to innovate. But maybe we are doing a wrong diagnosis of the disease. I don't know what you take on that.
Short answer of that is really difficult. So I really don't know what to say on that. So probably we can discuss it later on if it has to be short. The diagnosis I mean, I've been starting with that is really difficult to measure. So innovation and in diagnostics it's even more. So you need this cost effectiveness studies together with the clinical trials to know what would be the impact of identifying a disease. It's something that is being implemented more and more in the clinical trials, and something that we've been being asked in our program more and more. So obviously, this discussion we have had, not only therapies, but also prevention and identification of proper disease, is obviously something that you need to know when you need to treat somebody. Yeah. Okay, I need to treat you all to dinner in a minute, so we're going to have to stop it there. Can we please thank Jordi Vallés? And this is where we reach foundation, innovation, termination.